All right, everybody, thanks, and welcome back to TouchCare Talks. It's been a while since we've done one of these, and today I'm excited to have with me and be joined by Dr. Nicholas Lorenzo, who is the Chief Medical Officer at MeMD. Dr. Lorenzo, you want to introduce yourself real quick?
Sure. Thanks very much, Rob, and it's a pleasure to be with you and with the audience today. I'm Dr. Nicholas Lorenzo. I'm the Chief Medical Officer of MeMD and have been for coming up now on 7 years. And MeMD is a national telehealth virtual care provider and has been around since 2010. So we've been around for a while, and so I'm thrilled to be here to be able to share some thoughts with you.
Yeah, well, thanks for joining me, and thanks for taking the time out of your busy schedule. And I know that, right now, in particular, MeMD is very busy, and as are a lot of telemedicine companies, right? And a lot's kind of being made of what is a real boom in telemedicine, just given the state of affairs with the pandemic and with, sort of all sides of the equation. Providers being more willing to embrace telemedicine, consumers being more willing to trust telemedicine, and employers really starting to understand the need for and the important role that telemedicine plays in their overall benefits package from an access standpoint to their employees. But this hasn't always been the case, right? So you mentioned MeMD's been around since 2010. Tell us about some of the challenges that have really faced telemedicine from a legislative standpoint that maybe we're not talking about enough, that might be changing or are changing right now, that will really change the future of how we receive care.
Yeah, that's a big topic. And what I can tell you is that telemedicine, telehealth, virtual care has been around now for about a decade. And the market was growing. A lot of patients were starting to use it, and some providers up until the COVID-19 pandemic. So I do want to say that there was an industry in telehealth before COVID-19, and legislation at both the state and federal levels had progressed, especially in the last 3 or 4 years, to make it even a more friendly environment for virtual care. But with the COVID-19 pandemic, which started in March of this year, it really pushed forward virtual care and telehealth 5, 6, 7 years in about the last 7 or 8 months. It really did. And
wow.
One of the big reasons for this is, a lot more patients used it, but so did a lot more providers. Prior to COVID-19, about 20% of healthcare providers had ever used virtual care telehealth. But now that with the demands of having to provide virtual care with COVID-19, that number is anywhere from 70 to 80 to maybe even 90% of providers now have utilized virtual care. So it's this adoption, not just by patients, but also by providers, that has really pushed forward the industry at least half a dozen years in these last few months. And one more thought as well, because of the pandemic, both at the state and federal level, regulations and laws that govern telehealth were or have been temporarily loosened to try and get more people seen virtually because of the pandemic. And much of this will remain moving forward into 2021 and beyond, more than likely.
Yeah, and it's interesting to your point about provider adoption of telemedicine and virtual care. I just experienced this, right? I'm one of the few people, it seems, that gets a physical every year, and I just went through that process of getting my annual physical done with my primary care physician. And they were really pushing me to do a virtual visit instead of coming in. And that's the first time that's ever happened. And I'm not even sure they had a robust telemedicine platform before, but clearly they've invested in that, and clearly they're adopting it. It was probably a little bit forced in the early times of the pandemic. People have sort of returned to normal a little bit now, but they're still seeing this as a great option for them to be able to treat patients and still provide great care. So it's interesting.
Yes, and with the pandemic, the state and federal government laws and regulations were relaxed so that providers could use, and still can use, consumer level interactive audiovisual solutions like FaceTime, like Skype, and so on. Obviously, there are HIPAA and privacy concerns with those consumer-based systems. And down the road, we're going to start to tighten that up again. So, yes, a lot of providers have, for the first time, utilized virtual care telehealth, but they're now looking for a more long-term permanent solution that does guard patient privacy and record privacy and is compliant with HIPAA and privacy laws and regulations.
Absolutely. And Dr. Lorenzo, one of the major failures of our, I guess, healthcare system is, and it's a little cliche, right? But it kind of gets branded as a sick care system rather than a healthcare system. In other words, we, as consumers, don't use the healthcare system until we're sick, and the healthcare system is really set up to address that and not focus on getting us. It's focused on getting us better, not focused on keeping us well and preventing healthcare issues. Telemedicine historically has kind of been used in the same way, but I know MeMD and you specifically have been working on ways to really change that dynamic. Can you tell us a little bit about what you guys are working on and what you see as the future of telemedicine in that sense?
Sure. Before COVID-19, we had a very robust and active, basically virtual urgent care service. I think there are several of our competitors out there doing the same thing.
Yeah.
There's been a tremendous amount of growth in that virtual urgent care setting. But with COVID-19 and both patients and providers being more comfortable receiving care and delivering care in the virtual world, we're now seeing products like we're working on, which will launch in January, our virtual primary care service. And most people think to themselves, wait a minute, yeah, I love virtual care. Maybe I've done some of that virtual care for urgent care issues, but you can't get everything virtually. That is true. If you need, for example, an MRI or an X-ray, or if you need blood work done, that needs to be done obviously in a bricks and mortar setting. But with primary care, it's estimated anywhere from 60, 70% or more of that primary care can be delivered virtually. And so patients can now have a virtual primary care provider who could do much of what he or she needs to do virtually, but can then interface with a bricks and mortar system to get patients, for example, diagnostic studies, laboratory work, specialty consults, and so on. So I think moving forward, everybody realizes this is going to be a hybrid type of service, so virtual and bricks and mortar, but it's going to be quarterbacked, if you will, virtually, which will make it much more efficient and will provide many more touch points for the patient and the provider to communicate throughout the year.
Yeah, it's interesting, and it can seem like such a basic thing to so many who work in so many other industries outside of healthcare, right? And we always seem to feel like we lag a little bit in terms of innovation. It seems like this is, kind of an inflection point or a catalyst that is helping, to your point, really speed up the evolution of how we not just receive emergency care or urgent care in this country, but how we can interact with and actually take more of an active preventative role in our own healthcare in a virtual setting, so it's convenient and easy for folks, which is really exciting. One of the other, I guess, major themes or headlines that is really or has really made headlines during the pandemic is the need for better access to mental health and behavioral health resources. And sort of before COVID, we had a crisis in America where there was a shortage of providers combined with sort of a general stigma around mental health and mental health care that caused this to typically be put on the back burner, especially for employers who are driving the majority of healthcare coverage for folks. That dynamic seems to have shifted a little bit in recent years as employers are now starting to, realize and draw the line between sort of mental health and the social determinants of healthcare and how it all kind of plays together with overall well-being and productivity and viability, really. Tell us a little bit about why, and tell us a little bit about what MeMD is doing in this arena.
Sure. Mental health, behavioral health, psychiatric care really has been an underserved area of healthcare for at least 2 generations. I first started my career in healthcare over 30 years ago, and even then it was discussed that behavioral health, mental health, psychiatric care was underserved, not just in low population or rural areas, but also even in big cities. And that was
Sure.
30 plus years ago. So if you add those couple of generations together, it's been a long time that we've had this problem. And the opportunity to provide telebehavioral health, telepsychiatry virtually has really provided us an opportunity to address this issue. Also, with the technology, especially the younger generation, although some even in the older generations, are much more comfortable receiving care, both medically and behavioral health, virtually either through their computer or through their mobile device. And so this again allows easier access, higher quality of care, more different kinds of care as well, because it's not just the interactive video or interactive audio type of behavioral health care, but also the various software systems, the chatbots that can direct care. And so the technology that we're also used to on our mobile devices to do all sorts of things, whether it be playing games or shop or what have you, can be adapted and has been adapted to the healthcare system, including telebehavioral health and telepsychiatry. So it really is
Right.
providing care when and how patients want it. And it's very convenient. Patients like it, so patient satisfaction is very high. It's more efficient. It's better at treating and managing chronic disease, thereby lowering costs. And it provides, again, more touch points for patients. So they feel like they're more part of the management of their disease, whether it be behavioral health disease or medical disease. So all of these pluses have really pushed forward the telehealth virtual care market and industry here in the last 8 months.
And to that point, with behavioral health or mental health care, you sort of always have this, or at least I do, right? This image of, the patient lying on the chaise lounge or the couch in the psychologist office, staring at the ceiling and talking through their problems. But with virtual care really taking off and really focusing on mental health care in particular, how do you get access or can you get access to good quality mental health care in a virtual setting?
Yeah, I think I kind of touched on that already, but I'd be happy to
Yeah.
expand that you can still have the experience of a live interactive audio or live interactive video interaction with a provider virtually. So that's very possible and is done, many hundreds of thousands of times per day around the country. But there are also other capabilities technologically, especially for those in the younger generation who might want to receive at least some initial screening for mental health issues via a chatbot, via texting, secure texting, and so on. So all of the technologies that we have available, as I said, for other types of things we do every day, whether it be communication or other types of issues, or shopping, or other issues like that, we can all now adapt and have been adapted to the healthcare world, including behavioral healthcare.
Yeah. Yeah, it's interesting, and it does seem like, to the original point, telemedicine is obviously having a big evolutionary moment right now. And I really think we're going to look back on this pandemic a couple of years from now, or even to your point, right, 30 years from now, hopefully, and say that this was a real catalyst to drive some very much needed innovation and change in sort of the delivery of healthcare in this country. Tell us about how this all comes together. This notion of primary preventative care, breaking down some of the access and inconvenience and cost problems. How does this all come together, 3, 4, 5 years from now, if you were to look into the future?
Well, I think all the pieces are actually there even as we speak. And that is, of course, the technology is going to improve. It improves pretty much on a monthly basis, I think we've all seen here in the last several years. But the major pieces are already there. And the ability then to have a hybrid system, that is, the majority of your care can be delivered virtually, 50, 60, 70% of it can, and yet still being able to call in a specialist in a bricks and mortar facility if necessary, or to refer the patient for x-rays or an MRI or a CT scan, or to refer them for physical therapy or a colonoscopy. So it's going to be this interaction between the bricks and mortar healthcare system and the virtual healthcare system, all being directed and controlled and tracked virtually. And the patient having access to all of these records, to all of these results and being in much better control of their healthcare. And this is especially important for both providers and patients when we talk about chronic disease management. Most
Yeah.
people don't realize that anywhere from $8 to $9 of every $10 in healthcare is spent in the diagnosis and management of chronic disease. And the way that we do a better job with that, I think you touched on this earlier, is that instead of treating patients when they get sick, when they don't pay attention to their chronic disease, whether it be high blood pressure or diabetes or lung disease or heart disease, that we track them constantly, give them a lot of touch points where we can address problems when they're still small and minor and keep them out of the hospital, make medication adjustments, keep them healthier, keep them more involved in their lives, both professionally and personally. They're going to be happier. Healthcare costs are going to drop. The quality of the care that they receive is going to improve, again, because we're tracking them more closely. And they're going to participate more in their care because they're getting all of these touch points from the software system, as well as from the virtual healthcare provider, as well as the virtual healthcare team.
Yeah. Yeah, I think it's going to be really interesting to watch it all evolve, and it's kind of all taking place, to your point, as we speak. And why not healthcare, right? We've been in need of this innovation for a long time, and I'm excited about the way that things are moving and the way things are changing. And we are thrilled to be partnering with you guys and MeMD on delivering some of these solutions to employers. We really appreciate the way that you're thinking about kind of breaking down barriers of access to care and bringing more creative solutions and more holistic solutions and more proactive solutions to our members. And so really appreciate your time today. Enjoyed talking to you, and thanks again.
Well, thank you for having me, Rob, and it was a pleasure to be able to share these thoughts with you. And thank you to everybody who's viewing this for your time and attention.
All right. Thanks, Dr. Lorenzo.